Now, party conference season is with us once again. But it's not the fun type, at least not in Scotland, where SNP delegates will only meet online. One thing never changes, though. This autumn's Scottish National Party conference is likely to be dominated by a renewed push for a vote on independence for Scotland. Well, it would be easy to forget that for nearly 15 years, the SNP has actually led Scotland's government. They're responsible for tackling COVID, and they should be preparing to host the historic COP26 climate conference in Glasgow in just a few weeks' time. So joining me now from Glasgow is the leader of the SNP and First Minister Nicola Sturgeon. Good morning, First Minister.
Good morning.
Now, in the programme for government you delivered to the Scottish Parliament this week, which I suppose for our international viewers might best be described as a Queen's speech for Scotland, you were clear that COVID's your number one priority. Numbers are spiking. Is Scotland in danger of a further lockdown?
No, not at the moment. I think any responsible leader in the face of this virus has to keep options open and be careful not to rule anything out. We have seen a spike in case over the past few weeks. If you go back over the summer, we spiked above UK levels at the start of July. We then came down to some of the lowest levels in the UK, and as our schools went back, we saw cases increase again. We think we're seeing that spike start to level off and stabilise. The rate of increase has slowed down. So what we're saying to people right now is that in order to drive infections down further, which we really need to do, it's vital to comply with all of the basic mitigations that we still have in place. In Scotland, for example, it's still a legal requirement in certain settings to wear face coverings. We're encouraging continued good hand hygiene, good ventilation, and of course, although it's not the law anymore, asking people to think about distance from people in other households and thinking about their overall number of contacts. So good, sensible compliance with mitigations is what we think is appropriate right now. We also, this week, got approval from the Scottish Parliament for a very targeted and limited system of vaccine certification, which we think can help us reduce transmission in some higher risk settings. So at the moment, that's our message. We're going into, as everybody across the UK is, a very challenging and difficult winter period. So it's really important that we keep a very close eye on what is happening. And lastly, the overarching message to anybody who hasn't yet done so and who is eligible is to get vaccinated. The vaccines continue to be the single most important thing any of us can do to keep ourselves safer and to keep those around us safer.
You were very clear about vaccine certification, what is popularly called the vaccine passport. But some people, including experts like Steve Reichert, the behavioural science professor in Scotland, say that you should be concerned that the introduction of certification actually could put off some of the people that you've just said you want to take the vaccine. Is that not of concern to you?
Look, Steve Reichert, who's actually on the Scottish Government's advisory body, although he's entirely independent, of course, actually in a very long and very helpful Twitter thread during the week, gave a very balanced account, set out the benefits of vaccine certification, set out, and that it goes to the point you're making here, the things we've got to guard against if it is to work as intended, and also, quite frankly, set out some of the downsides. I think in the face of this situation,
he came out against it.
Look, people can take on-balance views. I think as part of a package of measures, it has a part to play. What I was going to say is, firstly, anybody who thinks there is one single magic wand solution to this virus probably hasn't learned enough over the past 18 months. And secondly, of course, any measure we take has upsides and it has downsides. I mean, if you take lockdown, for example, very, very effective at halting or significantly constraining transmission of the virus, but came with enormous costs in terms of the economy and our overall well-being as a society. So nothing is straightforward here. This is a very limited scheme. It's very similar to what is being proposed for England as well, and it has a part to play. Will it reduce the likelihood of people who are not yet vaccinated to come forward? I don't think there's any evidence of that. If you look at countries like France, that's perhaps the best example, we actually see the opposite effect. So the message is to everybody who hasn't yet come forward to take up the vaccine offer, please do so, because it protects you and it protects everybody. It doesn't eradicate the risk of transmission, but it reduces the risk of transmission, and crucially, it significantly reduces your risk of becoming seriously ill if you contract COVID.
Another big headline from your speech this week was your proposal for a national care service in Scotland, which would cover all types of needs, including disability and so on. Are you envisaging that there would be a spending cap in the way that the Prime Minister has proposed for England and Wales?
I think to ask me to address that question, Trevor, with the greatest respect, there has to first be an understanding of the completely different approach we already have in Scotland to the funding of social care. So it's not quite as simple as saying, are we going to replicate what is happening in England? So, for example,
that wasn't what I was saying. I simply just asked the question about whether there would be a cap.
But for me to answer that question with a yes or no would belie the differences, and I'm just not prepared to do it. So, for example, what we have in Scotland that doesn't exist in England is free personal and nursing care. So that means for anybody who needs social care right now, the state already meets a much higher proportion of the cost of that. Your personal care needs, or if you need specialist nursing care, that is met as well. So the funding landscape is completely different. And the arguments for a funding cap south of the border are not really the same in Scotland. Now, is the overall funding of social care still a key consideration as we move forward to a national care service? Absolutely. Alongside that commitment to a new national care service, we have a commitment in Scotland to increase funding for social care over this parliamentary term by 25%. That, in a Scottish context, is equivalent to about £800 million. The National Care Service is effectively, and I'm going to oversimplify here obviously, but it's effectively about making sure that we have consistent and consistently high standards of care across the country, that there's less variation, much greater consistency, and it is also about enabling a move to supporting a workforce so that that workforce is better rewarded. The National Care Service envisages, for example, national pay bargaining and a national wage for social care workers, because one of the issues, not the only one, but one of the many issues in social care is the undervaluing of those who work in it. And there's a bigger issue there, partly because it's a predominantly female workforce. So our starting point in Scotland is just so radically and fundamentally different in England that I would just guard against lifting what is being proposed for England, whether you agree with that or not, and trying to transplant it into the Scottish context.
One thing that is clearly true about Scotland is that right now, most of the care provision is in the hands, or it's controlled to a large extent, by local authorities. And Scottish local authorities, Cosland, and indeed the City Council in Glasgow, where you have your own constituency, have said that they are uneasy about what they see as a centralisation, what you've just called consistency, but essentially you are going to take the control of care service away from local authorities in Scotland and centralise it.
So, to be frank, this is one of the key debates at the heart of this reform. And I suspect in Scotland, as we move from what we've been doing over the past few months, which is consulting, into what we are about to do, which is legislate, this is going to be one of the tensions and one of the issues that we need to resolve. And you find this often running through policy discussions about this. One person's consistency, which is what I've just said, because often the complaints and the concerns that are raised about social care is that lack of consistency, but one person's greater consistency and less variability is another person's centralisation. So we've got to make sure we get the balance of that right. And of course, we'll listen very carefully to local authorities who have expressed concerns about that. When you're trying to make a big fundamental change here, when the country came out of the Second World War, the National Health Service was created. We're trying to create a national care service out of the trauma of COVID. You can't make big reforms like that without controversial and difficult issues to try to resolve.
But this isn't really a matter of balance, is it? At the moment, social care is largely run by the local authority boards. You want to take them into, I think they're going to be called Community Health and Social Care Board, which will be under the control and funded by the Scottish Government. And I'm not making a value judgment about that, but that is a change that you want to make.
Well, look, we already have joint integration boards across different parts of Scotland. Funding for social care comes initially from the Scottish Government, flows through councils. In terms of the provision, we have a mixed provision of state through local authorities, voluntary sector and private. Private care homes, for example, are a big part of our provision. So I guess I'm not trying to shy away from this. The point I'm making is that if you take your starting point, which is I said earlier on, the starting points in Scotland are different to elsewhere in the UK, but perhaps one point of consistency is that the current arrangements around social care are not as good as they can be or as good as they should be. So if you accept that, and say we want to reform to make it better, you're going to have these debates, but let's have them. And out of those debates, let's get a care system that is fit for purpose, learns the lessons of the pandemic, and is something that in years to come we can look back on with some pride as a good thing that happened out of this COVID crisis. There'll be difficult issues in this for all governments across the UK, but I think it's time to face up to them.
You said in your speech that you want to have a further independence referendum by 2023, COVID permitting. Can we just deal with the narrow question of timing and COVID? What does that actually mean? What level of infection or hospitalisation would make a referendum impossible, given that you've just had elections in Scotland in the middle of a lockdown?
Well, we just had elections, and of course, and just before so that I don't miss this point, the SNP won that election on a commitment to an independence referendum with a historic share of the vote. Our constituency share of the vote was higher than any party has achieved in the entire lifetime of the Scottish Parliament. So it's probably a point of context that might be important for our discussion.
Yeah, OK, fair enough. But what would stop you having the referendum? What about COVID would stop you having a referendum?
If you can let me, I'm going to try and address your question, and I'll try to do it as fully as possible. You've made the comparison with the election. This is not just about safety of polling stations. It's about making sure that as the country faces a big, important decision about its future, it's able to focus on that properly and that it doesn't have looming over that a COVID crisis. So right now, you started this interview rightly about talking about the recent spike in cases in Scotland, putting enormous pressure on our National Health Service, leading me as the First Minister to continue to advise people to take great care about their interactions. I don't think that kind of situation would be the best backdrop to the country considering and making a decision on its future. I'm not going to set a precise level of infections, but you would want to see the COVID situation under control, the pressure on our National Health Service significantly lower than it is right now, a sense that we weren't still in the acute phase of this crisis, but also crucially, and I think this is crucial, a sort of overall environment in the country where people are not in their day-to-day lives being asked to, even if not comply with legal restrictions, still limit or restrict their own day-to-day behaviour. Ultimately, of course, as with many things in the life of governments, it will be a matter of judgment, and it's important that I get that judgment right, because I'm very, very serious and have been for 18 months when I say the biggest responsibility, the most serious responsibility on my shoulders is steering the country through the biggest health crisis in a century.
First Minister, you know me well enough to know that this is not the sort of thing that would cross my mind, but there are some nasty, cynical people who would say that the judgment you really want to make is when will it be more likely that you get the answer yes from a referendum, because right now the polls don't tell you yes, we want a referendum, or indeed if there were one, that you would definitely win. And that really, when you say COVID permitting, what you really mean is when it's politically advantageous to me, Nicola Sturgeon.
I think it's right for the country. Look, I'm not going to sit here as as a politician and say that in any decision, I mean, we have fixed-term parliaments in Scotland, so it doesn't arise, and for the time being there are fixed-term parliaments in the UK, but when that wasn't the case, Prime Ministers, of course, used to make judgments on when they would call a general election based on when they think they could best win them. Any politician is going to factor those kind of judgments into those decisions, and I'm not going to sit here and pretend otherwise. Of course, some polls right now do suggest that yes would win. Others suggest that yes is slightly behind. I'm very confident that when this question is next put, people in Scotland will vote yes. And one of those reasons is that we have seen that all of the things that were said to Scotland by the No campaign in the referendum in 2014, not least that being independent would see us lose our European Union membership, have turned out to be false. So I'm confident about that. But my primary consideration, and the two are not completely divorced from each other. My primary consideration is to do what's right for the country. When is it right? I think it's right that the country gets to choose its future. There are big decisions that are falling to be made by governments everywhere as we emerge from this pandemic. Who do we want taking these decisions? Democratically elected governments here in Scotland, guided by the values of the Scottish people, or governments like Boris Johnson's in Westminster that we don't vote for. So that's the choice, and we should get to make that choice when the time is right for the country to do so.
Well, let's talk about the values of Scottish people and what an independent Scottish government would look like. I've seen the video that your party's put out ahead of the COP26 conference, proclaiming that Scotland is ready for net zero. Does that mean closing down oil production in due course?
We're in a transition away from fossil fuels, so oil and gas production is not going to last forever. The question is the pace at which we do that. I think we've got to see that pace accelerate. I think there are big questions over whether we should continue with new exploration in the North Sea. And the other question is how just is that transition? Because what we don't want to do is repeat the mistakes of the deindustrialisation that was underway and that we had the legacy of when I was growing up, where individuals and communities were just thrown onto the scrap heap. So it's about the pace and the justice of that transition. We are already in that transition, and we've got to make sure that it happens at a pace that is consistent with our net zero ambitions. We have a target in Scotland to reach net zero by 2045, but actually we've got an even more stretching target, which is a 75% reduction in emissions by 2030. So there are big challenges for Scotland here, but there are big challenges for countries across the world. Glasgow is about to host COP, and this is possibly the last chance the world has to do what is required to meet the Paris Agreement of limiting temperature rises to 1.5 degrees. And we've got to get a Glasgow agreement that allows this generation of leaders to look the next generation in the eye.
You just made a very important point, which is that you've got to judge the pace, but what you don't want to do is to create more production. Now, does that mean that you have decided that the Cambo oil field, which I think is east of Shetland, which where there's oil companies have applied for a licence to drill, that you have decided that you oppose the exploitation of that field?
So again, let me address this, and I've set out my position clearly. Firstly, can I just factually correct your introduction to that question? The developers of Cambo have a licence. They've had that licence for, I think, 20 years. What they need to now do is get permission to start exploration and production. So the licence is there, which is part of the complication of the issue.
Forgive me,
it's not a decision I can take.
Are you against bringing oil ashore from Cambo?
Well, I think that there has to now be a process of reassessing that. Now, what I was going to say is it's not my decision, it's a reserved matter. I've asked the Prime Minister not to simply go ahead and grant the permission to go ahead with production as a matter of course, that the licence should be reassessed against the same kind of climate requirements as new licences are going to be assessed. Now, there are issues here that have to be considered. The pace of the move away from fossil fuels, but in a way that doesn't throw people on the scrap heap, but doesn't inadvertently increase our reliance on imported oil and gas. So you're asking me you're about to ask me to simplify this.
Your Green partners in government are pretty clear. They think you shouldn't And I'm asking you, if you'd had your druthers, would you not have that oil field exploited?
I wouldn't give the go-ahead without a fundamental reassessment of the licence. That reassessment, the licence exists, so you have to do that reassessment. So I wouldn't give the go-ahead without that reassessment to enable that to be done against the requirements of climate change, so that there is that rigorous assessment of whether going ahead with new exploration, which I think many people and increasing numbers of people question whether that is consistent with our climate change targets. So that assessment, in my view, should happen.
Let me just quickly take you to a couple of rather controversial issues, I think, that your government's addressed. You've issued guidance on racism to schools, which advises teachers to take a test to measure their white privilege. Have you taken that test, First Minister?
Sorry, I haven't. I'm happy to do so. But, you know, if you want to give me more detail of that, I will certainly consider it. But I'm not entirely off the top of my head sure what you're referring to.
Well, it is a test which says, because of who you are and how you're born, you have privilege, in your case, which I, in my case, do not have. And the advice that your Department of Education has given is that schools should give, that teachers should take this test to demonstrate that they, because they're white, have this advantage. And I think it would be rather good. I mean, why don't we do a deal that the Scottish Government Cabinet takes the white privilege test, and one of you or one of your colleagues comes back on and tells us what the results are?
Look, I'm happy to do. I think these things are really important. I don't have the particular guidance in front of me. I'm not trying to dodge your question. I did an interview with one of your competitor channels on Friday about many of these issues, and as we consider all of these issues, people like me, you know, white people, have to constantly remind ourselves that we have privileges that others don't have. So I'm perfectly happy to go away, look at the particular guidance, and if there are things that my cabinet should do to make sure that what we're asking others to do are things we're prepared to do ourselves, I'm happy to do that. That's
a date. Very last, very simple, straightforward question. A lot of work on the gender reassignment issue. Do you agree with the most famous Scottish-based writer J.K. Rowling that there is a biological basis to sex and that you, for example, are a woman? Not a person with a womb, but a woman.
I am a woman, and yes, I do think there is a biological aspect to sex. I'm not going to simplify this by sort of saying, do I agree or disagree with J.K. Rowling? There's many things I agree with her on. I'm sure on some of the nuances of this we might take a different opinion. But let me, address directly the issue of the Gender Recognition Reform Bill, something that's happened already in many other countries, Ireland included. This is about making it easier for trans people. They can go through this process already, but it's about making it less degrading and traumatic for trans people to legally change gender. It does not in any way, shape or form remove the legal protections that women have, and that's important to me as a feminist. But trans people are amongst the most stigmatised minorities in our society, and we should try to reduce that if we can. But also there are real threats to women across the world right now, from abusive men, predatory men, misogyny, sexism, places like Texas trying to reduce the right to abortion. Let's focus on the real threats to women's safety rather than things that might be perceived threats, but in reality, in my view, are not.
Right. First Minister, much appreciated. Thank you very much.
Thank you.
That's it from us for this week, but stay with us now for The Take with Sky's Deputy Political Editor, Sam Coates.